Hello, everyone, and welcome to our discussion today, Understanding Lab Work. My name is Kelly Condon. I am the Program Coordinator for the Texas Oncology Foundation. If you are new to our community, I first just want to welcome you and just give you a little background. We are the Texas Oncology Foundation, and we are dedicated to providing support to cancer patients in the communities where they live, work, and receive treatment. Today, we have Lance Ortega with us. He is an oncology nurse and has been one for over 10 years now. Lance is the Director of Nursing Services for Texas Oncology. And if any of you are in our DFW area, you might recognize him because that is where he is located in our Texas Oncology sites. Lance, we are so happy to have you partnering with our foundation on this presentation. Thank you for spending time with us sharing.
Perfect. Thanks so much for having me, Kelly, and welcome everybody. So like Kelly said, today we're going to be talking about understanding lab work. So I think it's important to just kind of go back just one step and just really talk about what is cancer. So cancer is a normal body process of rapidly dividing cells. One of the many parts that makes cancer so nasty is it takes a normal body process and it makes it go out of control. And so that, in a nutshell, that is what cancer is. It's just rapidly dividing cells that don't stop. And in doing that, it crowds out the normally rapidly dividing cells and leaves those cancer cells in its place. And when that happens, that's when it starts spreading to other parts of the body through the blood and lymph system. So, we have to treat cancer in many different ways, but one of the most common ways to treat cancer is through chemotherapy. So we give this chemotherapy that kills rapidly dividing cells. So the issue that we run into many times is that the chemotherapy can't distinguish between the good rapidly dividing cells and the bad rapidly dividing cells. And so that's where a lot of our side effects come from. Whenever we're looking at cancer treatment, specifically with chemotherapy, is that injury of the good rapidly dividing cells. And so that's why you don't get all your chemotherapy appointments one right after the other. We give you chemo, and then typically you have to wait a week or even a couple weeks to let your body recover from that, and then we bring you back in and give you more until we finish the course of your regimen, whatever that might be. So in between that time and before every treatment, we monitor your blood work to see how your body is recovering and responding to the cancer treatment that we're giving you. All right, so whenever your doctors and your nurses are looking at your blood counts, they're looking at many different things on there to see if it's okay that you get treated that day. So one of the very first things they look at is something we call the complete blood count, or the CBC for short. So when you're looking at the CBC, you're looking at red blood cells, which is basically the nutrient or oxygen bringers to the rest of your body and to your tissues. You're looking at your white blood cells, which are the things that fight infections, whether they're viral or bacterial or anything that's foreign in the body. That's what the white blood cells fight. And then the very last thing is your platelets. So things that help your body clot off cuts, bruises, wounds, things like that. So the normal ranges can vary by age, sex, population. Even the kind of machine you use has different normal values, but they're all relatively the same. So whenever you're reading a blood count or a lab report, many times they'll have a normal range or a column for normal ranges right next to whatever your results are for that day. So it kind of tells you where you fall in that spectrum. So again, looking at the 5 major measurements of a CBC, we talked about these, but going further into that is, your WBCs, you fight your infections that we talked about. But even within that, there are multiple parts of your white blood cells. So you have neutrophils, lymphocytes, monocytes, which are all big names for different types of white cells that fight different types of invaders to the body. And so when we're looking at your CBC, many times we'll run a differential to see how many of each certain kind of cell you have, because we know if you don't have enough white blood cells that specifically fight bacterial infections, then that can be really bad because there's bacteria everywhere in our everyday life. And so we want to make sure that those specific type of cells called neutrophils are high and that you have enough to function day in and day out. The next thing that we look at is your red blood cells. So again, those are the things that carry oxygen and remove waste from different parts of your bodies and tissues. And specifically, we're looking at the hemoglobin, which is the oxygen carrying capacity of blood, and your hematocrit, which is the total percentage of your blood that is red blood cells. So those are respectively called your H and H. So if your doctor say, well, your H and H is kind of low today, those are the two lab results they're talking about. Now, if the H&H gets too low, then there could be times where you have to go and get a blood transfusion. So, you know, a unit of blood or a pint of blood, you might hear that is why you have to go and get that, is if your hemoglobin and your hematocrit get too low. And then the very last thing is the platelets. And again, those are the things that form clots. And so, you know, if you get cut and your platelet level is normal, then you stop bleeding pretty quickly. But if you get a cut and you don't have any platelets, or you don't have a lot of platelets, then that can become a bigger deal. A minor cut can keep on bleeding forever. Or if you had some kind of big trauma like a car accident or fell or got cut with a big knife, then that bleeding might potentially be an emergency depending on how bad it was and how low your platelets were. So this slide, and I know there's a bunch of colors on there, but I've kind of highlighted those different areas. So if I'm your infusion nurse or I'm your doctor looking at your labs, these are the areas that my eyes are immediately drawn to. So the very first thing is your white blood cell count. So for this patient, you know, their white blood cell count is normal. And actually kind of high normal, so that's good. If it went too high, then we might be a little worried that they could have an infection, but they are still within the normal range, and so this person looks good. The next thing we're going to look at is that HGB and the HCT, which again stands for the hemoglobin and hematocrit. Those look good. Again, they're within their normal levels. The next thing we're going to look at is the PLTs, which is your platelets. That's normal for this patient. And then looking at your neutrophils, which shows as ANC or absolute neutrophil count, those are the parts of your white blood cells that fight bacterial infections. And so again, we want that to be in the normal range or in the middle to high normal range, because that is what's going to keep you safe from many things that you come in contact in your everyday life. So all of that being said, if some of these numbers are lower and you are a cancer patient receiving active chemotherapy, meaning you are in the middle of chemotherapy, your numbers are going to look normal than the reference range, because we know that we're giving you chemotherapy and we're giving you drugs that's going to lower your body's ability to produce these healthy white blood cells, the healthy red blood cells, and the platelets. Because again, cancer is rapidly dividing cells. Chemotherapy fights rapidly dividing cells, and your blood cell counts are produced in your bone marrow, which house rapidly dividing cells. So that's why chemotherapy affects these numbers, is because it attacks all of those rapidly dividing cells. So if your numbers are lower, that doesn't necessarily mean that your doctor won't treat you that day. It's like there's an expected deviation from normal for a cancer patient. However, if it gets below that threshold, and that threshold can be different from patient to patient, or even the types of medications you're receiving, then sometimes your doctor could hold your treatment for that day if your counts are too low. All right, so kind of diving into the white blood cells specifically again. Again, we talked about a differential because there are different types of white blood cells. And so when we're talking about those different types of white blood cells, we break it down into percentages. And so the five main ones are the neutrophils, the lymphocytes, the monocytes, the eosinophils, and the basophils. And for the purposes of chemotherapy and for this discussion, we're really going to just focus on the neutrophils, because that's, again, is what fights the bacterial infection. So going back to this example, we see that our total white blood cell count was normal or in the higher end of normal, and the neutrophils were fine. So if this patient was presenting for treatment that day, then this is somebody that could get treated because their white blood cells, and specifically their neutrophils of their white blood cells, are high enough to be treated and not potentially be detrimental to that patient for that day. So again, really looking at your blood counts and seeing what this tells you about the picture. Now, we don't solely just look at what the blood's telling us. That's why it's important that you get in front of your doctors and your nurse practitioners or physician assistants, or even your infusion nurses, because not only do they look at your labs, but they're gonna talk to you about your symptoms, how are you feeling, even your general appearance can tell a lot. And so there could be times where your blood counts are normal to be treated, but maybe there's something else that's going on that kind of tells that clinician that, I don't know if we should proceed with treatment today, or maybe we should delay a couple days or a week. So, whenever we are talking about this, it's helpful to understand that this is what your care team is looking at, but realizing also that there are other factors in play that can affect you getting treated. All right, so moving on, the next thing that we look at is something called the serum chemistry, and you might hear this referred to as a CMP for whenever your doctors are looking, your doctor or your nurses are looking at your lab results. And so for your chemistries, that shows us things like potassium, sodium level, magnesium level. It shows us how your liver's functions are doing. It also shows us how your kidneys are doing. And all of those are important because cancer affects different tissues and different organs, but also a lot of the filtering part of your body comes from your liver and from your kidneys. And so it's important for us to understand how those are functioning, so that way we know what the overall picture looks like for you when you're getting treated. And it kind of gives us an idea of how you're responding to treatment, or if you're going to be able to tolerate treatment that day if you're in for your next round of chemotherapy. So if your liver functions test are increased, meaning that your liver is getting impacted, and again, your liver is one of your main filtering organs of your whole body, that you might have to, your doctor might have to come down on your dose of chemotherapy. We might have to give you more fluids that day, or you might just be held all together for a week or a couple weeks to let your body recover. And so specifically in your liver function test, we're looking at something called total bilirubin and your ALT and AST. So those are your three main components of your liver function test. And if these are high, it could be indicative of liver damage and maybe a sign that cancer has spread, but really it's probably more likely that your body just needs to recover a little bit. The one cool thing about the liver, it's the only organ within our body that can heal and repair itself. Like a starfish, for example, can grow back a limb. A liver can kind of do that same process, but it does have a point of no return. So if we insult it too much or we hurt it too much, then there's a time where it can't heal itself, and it's just not functional, which would obviously not be good for you or anybody if that happened. So this is what an example of a CMP looks like, and it does stand for Comprehensive Metabolic Panel. I'm sorry I didn't tell you that before, but this is what it would appear like for if you got labs drawn that day. And again, your provider is going to look at the different things to see how your body's responding to treatment. And the last thing for labs, and this is something that everyone is very interested in focus on whenever you're coming in, is tumor markers. So cancer cells and other cells in the body produce substances known as tumor markers in response to certain conditions, whether they're cancerous or non-cancerous. In cancerous conditions, they are produced at much higher levels. So whenever we're drawing this, we're also using this as another diagnostic tool to see how your overall cancer is progressing or how treatment is affecting your cancer. So these markers are drawn periodically and again used to monitor how you're doing, and they can help with detection, diagnosis, and the management of certain types of cancers overall. So looking at commonly ordered tumor markers. For breast cancer, one of the most common one is a CA2729. For pancreatic, liver, gastric, colorectal cancers, sometimes we can see a CA199 drawn. For ovarian cancer, it's a CA125. So one of the questions that I get a lot from patients is, how come tumor markers aren't drawn every single time I'm in there? And the reason for that is clinical, but then also that nasty word of insurance plays into it as well. Is that one, we want to give your body time to respond. If we see one right after the other, it doesn't really give us a good picture. We want to give you chemotherapy, give it a couple weeks to let your body even out, and then see how your body's responding and what your tumor marker levels look like. The other part is that these tests can be very expensive, and so Medicare and commercial payers don't like to pay for it every single week. So that's why it might be every couple weeks or every month that you're getting a tumor marker drawn, as opposed to a CBC and a CMP, which gets drawn pretty much every time you're in the building. And this next slide is just showing an example of a CA2729, which again would be something that you would draw on a breast cancer patient to see how they're doing. And so on this particular one, they're kind of in the middle range of this level for the reference range of this particular tumor marker. So, if they stayed around this level all time, then we would say that this person probably has stable disease. Or probably not reoccurrent disease. Now, if this level was 1,800, then that's when we would be concerned that potentially something's going on with their cancer. And just kind of wrapping up some more common tumor markers that you might see, a CEA is kind of like a catch-all generic tumor marker that isn't overly specific. However, it is a good indicator for colorectal and GI cancers. For those hematologic malignancies or blood cancers, the immunoglobulins are very common to be drawn and monitored. So people with lymphoma or multiple myeloma, you might see these being drawn on you. And then the very last thing on here is a PSA level. So those are for prostate cancer patients and looking how it's going. But it's very common for men over 50 to get a PSA level drawn and just seeing how the prostate is doing. And it shows overall prostate health. So I know this was quick, but hopefully it was very informative. It kind of tells you what your clinical team is looking at when you're coming into the clinic every day, and hopefully gives you a little bit more insight into what your doctors are looking at and how you as the patient can take these labs and feel a little bit more comfortable with looking at the different parts and, kind of ignoring the things that don't really pertain to you that particular day and focus on those really important things like your white blood cells, your red blood cells, some of your chemistry levels, and even your tumor markers when it comes down to it.